Good afternoon, everybody. I thank you for joining ASU for a town hall meeting this evening. Our topics this evening, we're going to talk a little bit about academics, and we're going to also talk about university activities and how things may be a little bit different this fall. We're going to have an abbreviated semester and health and safety measures in place. One of the things that has become so evident as we have come through the last 6 or 7 months, we entered this situation with COVID-19 in January, thinking this is going to be an evolving situation. And we told everyone this was a rapidly evolving situation. And it didn't stop then. That is still the case in July. It is still a rapidly evolving situation. And the answers that we gave in a town hall meeting 2 weeks ago might be different today, but I can tell you we've got a very dedicated team of people working to make sure that return to campus in the fall is safe for everyone. So I am Becky Bracken. I'm the moderator for the town hall this evening, and I'm also Director of Communications and Marketing for Angelo State University. The slides that you saw at the beginning explain some of the housekeeping for today's meeting. I want to remind you that our meeting is being recorded and will be available later on our website at angelo.edu/commitment. So we have a team tonight of people from academics, all different areas of campus, that will answer some of the questions you sent ahead of time about the reopening in the fall. And we'll also try to address some of the questions that you submit this evening. Our panelists tonight are, as you saw on the slide, Dr. Javier Flores, Vice President for Student Affairs and Enrollment Management, Dr. John Wegner, Dean of the Freshman College, Jessica Manning, Director of Business Services, and Dan Robertson, Director of University Recreation, or you may know it as UREC. So we'll start by answering the questions that you submitted online previously. And then when we get through with that, we may have answered some of your questions that you've submitted on the Q&A just now, but we'll get into the Q&A questions after we get through the pre-submitted ones. So we'll start out with a question for Dr. Flores. One of the questions on everyone's mind is, how are athletic events going to be handled? And in conjunction with that, how are Ram Jams, our tailgate, going to be handled? So.
Well, good evening. And first of all, Becky, thank you for having us, and all of you that are a part of the RAM family. It's so good to see you and to have you. So that absolutely is the question of what will athletic events and Ram Jam look like? And I think you're going to hear a theme tonight, and that theme is that the safety of the Ram family is most critical, and it is priority in everyone's mind. The second thing that you're going to hear and hear frequently is we will follow CDC guidelines and any directives from the governor. So we know at this point that the governor of Texas, Governor Abbott, has told us that we can have events in athletic events. And he has designated the capacity for outside venues and indoor venues. So we will follow that. But to tell you that 50% capacity, which is what we're being told today, will hold true in September when we have football events and or soccer and volleyball, may not hold true. So we will follow the guidelines and we will follow the regulations that we have. We do know that on campus, any part of the Angelo State campus, a facial covering is required, and you can use whatever you would like to use, something that you use as a gaiter around your neck. You could use a mask, and for individuals that may have different needs, you should probably see the Office of Disability Services so that Dallas Wofford can guide you relative what you can use. RamJam, same thing. The other thing that we, the administration and the Angelo State community have said is our events are primarily going to be for our students. Student events are going to be primary because there is learning that comes out of events that we have for our students, and we have learning outcomes associated with those. So we're still working on RamJam, but we can tell you that it will look different than it did before. And the first thing is the facial covering will be required.
All right, thank you, Dr. Flores. All right, we'll move into questions about our schedule and classes for the fall. So Dr. Wegner, I'll give you the first question. We know that our semester is going to end on November 24th. And what does that mean for finals? How will finals be handled and when will they happen?
Thanks, Becky, and I too welcome everybody here. And then Dr. Flores, I thought you just had kind of a cool ascot on, and you were styling right there. I didn't realize that. That was a face mask too. And the other thing, by the way, I look at my picture and think, man, I should update that and buy a brush. Evidently, I wasn't quite. Ooh. So a picture my mother would not be proud of, I suspect. So final exams. As you know, we're finishing the semester on the Tuesday before Thanksgiving, and we are actually, when students go home for Thanksgiving, we're not asking them to come back to campus. We know that there's going to be both the flu and perhaps the COVID-19 still in the air, and we want, as Dr. Flores said, to make sure that the faculty, staff, and students are as safe as they can be. And so we're going to have this semester that starts the 17th and ends the Tuesday before Thanksgiving, and final exams then will be on Friday, Saturday, Monday, and Tuesday that week before Thanksgiving. So we'll be finished on that Tuesday. Students can travel on Wednesday to go home for turkey and dressing and whatever else it is that your family does. And then you can sleep in Monday because you don't have to study that week because you're already good to go. And so that's how we're going to do it. Now I realize that I can hear sort of anguished sighs from students about Saturday morning exams, but you know, you'll be fine. I think by then you'll be so ready for the exam, you'll be good to go. And if truth be told, many universities have exams on Saturday. So Friday, Saturday, Monday, Tuesday, exams, pretty much the same schedule that was already posted. It's just that the days themselves have changed. And then we're all headed home to practice some gluttony and see our families at the end of the semester.
All right, thank you, Dr. Wegner. I'm going to give you the next question as well. We have received a number of questions that pertain to the delivery of classes. Some of them have asked if they have a preference or a situation that prevents them from taking face-to-face classes. Will there be online options? Others have asked it the opposite way. What is your advice for students in this situation?
So, Becky, you still have your magic 8-ball, right? Because my advice is they just take that thing and see what. You know, it's a great question, and I get it. I mean, everybody's a little bit unsure about what things are going to look like over the next couple of months, and we know that you know, the spring semester was sort of a shock to the system. I think one of the things that I really am most proud of at ASU, and I've been here since 1997, is we're incredibly flexible. And student learning is at the forefront of everything that we do. And so a couple of things before we talk about what classes are available. I want to remind everybody that last fall, pre-COVID, so PC, 51% of our students took classes online. So online learning is not something new to us, and it's not something that's unusual. We have a whole slate of courses online. We have some degrees that you can get online. We feel relatively confident that if you're one of those students who wants an all online schedule, that we can make that happen. So what I would say to any of the questions, any of the things that I'm about to say is you need to reach out to your professional advisor, your faculty advisor, and get some advice on which classes. I mean, we don't want you taking just online classes for the sake of taking online classes. We want them to apply to your degree and move you toward graduation. And so we have the ability to provide online classes for most students. We also last year started a partnership with a company called Acadium that puts us into a consortium of universities that offer online classes. So it's another tool in our toolbox to help students get a complete schedule and make progress on their degree while taking online classes if they need to do so, because we know that that's something that some students need to do. As you say, though, Becky, we also know there's some students who, when you say they're going to go online, they sort of get the deer in the headlights look and panic a little bit. And I can assure you, we have face-to-face classes. We're going to have on-campus classes. As of right now, as Dr. Flores pointed out, and as Becky pointed out, you cannot sue me if that changes tomorrow, because it won't be our fault, I promise. Our goal is to make sure that we offer those classes. Now, they're going to look a little different for some of you. Some of you are going to have face-to-face classes that are just like every other class you've ever taken. They're going to be relatively small. We really pride ourselves at ASU on having a small faculty to student ratio. And that actually is great for us right now because it gives us a chance to have some classes where there's almost no disruption. Now, in those classes, we might have faculty recording the class. If something happens and a student has to miss a course, we're going to try to record those sessions to make sure that students can go back and look at those. We'll upload those into a Blackboard course. By the way, not an unusual thing. Universities have been doing that for years. And we'll see two other kinds of classes for students. Becky, we'll see hybrid classes, which are literally a thing. Again, they've been around for a long time. And a hybrid class is a course where part of the class is online. And so you might have lectures online and you might have some exams online, but you have one or two face-to-face sessions, small sessions with faculty where you get together to ask questions about the lectures, where you get to do kind of applied stuff in the classroom. But it may mean in a hybrid class like that, you go once a week. But, you may go Monday, some other people go Wednesday, blah, blah, blah. So we'll see that. That's a very specific thing. And then what we're going to see a lot of is something that's been around in higher education for years and years and years, and it's called a flipped classroom model. And in some respects, I'm a professor of English, and this is kind of how we've always done it, right? We assign you a novel, and we might have you do some outside reading, and you do all of that outside of class. And when we come to class, we really get into the analytical part, and oftentimes that involves students working with other students. We're going to see a good bit of that this semester, because one of the things that we know is we don't want to have a class with 100 students packed in on top of each other in the middle of this kind of event. So we want to make sure we can spread that out. So I think one of the things you'll see is faculty. In fact, I'm doing this with my class. I'm teaching a class. I'm going to record some lectures. I'm going to have some things available online. And then what we'll do in the flipped class is when the students come to class, it is all about application of the material. And so, again, this has been around a long time, and it's a really good way to teach, because for you as students, you don't go to class and listen to a 50-minute lecture. Not that there's anything wrong with that, but what you do is you listen to the lecture and you go to class and you do the application of that information in class. And we find oftentimes that the learning is even more powerful and stronger. And so we know that, so that's kind of the four ways. And then again, there's going to be a variety of options that merge out of that. But the one thing I would say is, don't let the spring be your guide to what the fall is going to look like. I mean, we work with some of the smartest people in the world on this campus, and they're working and have worked throughout the summer to develop classroom models that keep you safe, but also make sure that you meet and get the learning that you need in order to graduate, to go off and do the things that you want to do. So I hope, Becky, that answers that question. And but the short answer is yes, you can go online, yes, you can go face to face, and we can't personalize education for all 10,000 students, but we're giving it a shot.
A follow-up question to that, Dr. Wegner, is how can students who prefer face-to-face classes find a list of those classes or the professors who are offering face-to-face classes?
You just got to go knock on everybody's door. No, I'm kidding. That's not.
Okay.
I tell you that the best way to do this, quite honestly, is I know you can look at the ASU schedule online. And so you can go on that. And if you're a student, you can look in Rampart and you can go in there. If you're still considering applying, there's the catalog is available online. And when you go online, if the course says, you can actually filter for distance ed or lecture or face-to-face or hybrid. So you can actually filter the classes like that. But honestly, the best way to do it, if you're trying to build a schedule around either all online or partially online or all face-to-face, is to contact a professional advisor. And if you don't know who your advisor is, you can shoot me an email and I will hook you up with the right person. I will make sure we get you to somebody who's gonna get you in the right classes.
All right, perfect. You talked a little bit about classroom capacity and how that would be handled. I know that our office in particular has been producing signs to go across campus. I'm not sure there's a square inch of campus that isn't going to be covered by some sort of communication about what to do and where to sit. Um, so I know that in some classrooms there may be signs on desk that say this desk not in use or this table not in use. Um, are there other ways that social distancing and safety are going to be addressed as far as classroom capacity, Dr. Wegner?
Yeah, I mean, we're in terms of the way even the flipped classroom and the hybrid models are working, is we're actually working with our space utilization folks to make sure that we're keeping students 6 feet apart. And as Dr. Flores mentioned at the beginning, we're going to have face masks on. And I think one of the things we all want to remember is the goal is one or the other. If you can do both, it's great. That increases or decreases your odds, but the real goal is to do one or the other. So we'll have face coverings of some sort. We'll have classrooms where there's spaces, students are spaced out. So if you've had one of those classes where, there's the fire code's 44 and we have 44, maybe 45 if we can squeeze them in there, we're using, that's not going to happen. I mean, so we're going to make sure that our classes are sized appropriately for social distancing within the classroom and have face masks on. Professors are going to be a good 6 to 10 feet away from most students. And then my guess is even in the way the class is delivered, some of those group activities that you were going to do are actually going to be online. I should add as a caveat though, labs, labs will have the same sort of requirements they've always had. If you've had a lab, and it's a face-to-face lab, you've had to wear a coat, maybe a face shield, and you have to have closed-toed shoes. We're just going to add a mask on top of that as you go in the lab, because you can't always social distance if you're working with 2 people. There's one piece of equipment. So we're going to have that, and we'll have some gloves that make sure that we're not touching the same device, and we'll also be able to clean those items throughout the semester to make sure that we're not passing those things along. But I'll add one last thing, really, Becky, that and to remind everybody out there that really the responsibility for this is up to each and every student. I mean, whatever you learn in kindergarten, right? Wash your hands, keep your hands out of your mouth and other parts of your body, and keep your hands to yourself, right? If you keep your hands to yourself and my hands are to myself, we're probably 6 feet away. If you'll do that, and we're really taking care of each other, which is what we want when we go into the classroom.
Great point. We've tried to think of everything, but our students are going to have to help us too. All right. The next question is directed at Dr. Flores. One of the questions has been, how is marching Ram Band supposed to continue if students are required to wear face coverings?
Just as enthusiastically as it was last year. So, band is a great example in that you really can have social distancing. I mean, you watch a marching band and they separate and they may come close together and so forth. But, the question is probably, will the Ram Band be at Ram Jam and things like that? That's another difference that we'll probably see at Ram Jam is we may not have the marching band come through because we know that becomes a very confined space and they won't be able to wear their mask as they're playing their instruments. So that could be different. But when they're on the field, they are certainly far apart from others. And as they're playing an instrument, that's almost wearing a mask because you're playing an instrument. Now, percussionists will probably have a mask because they wouldn't have an instrument in their mouth or a mouthpiece. So very, very carefully. But I think the other part of this question is really, how does some of the activities that we have come to love and create the environment of the RAM-FAM and the culture of ASU. So the marching band is one. I know intramurals and things like that, and I would love to turn it over to Dan so he can speak about how we will handle intramurals and some of the activities at the University Rec Center.
Thank you, Dr. Flores. I will go the same route as Dr. Wegner and Dr. Flores. First and foremost, the safety of our students is what our focus is going to be with intramurals. We're going to follow CDC guidelines, local, state, and federal guidelines as well. But we're going to try, and we are planning to offer the sports that we've offered in the past. However, we understand that those sports that player-to-player contact is inevitable, those are going to have to look a little bit different. And so we're going to push a focus towards our team and our team sports where player-to-player contact is not as likely or eliminated. Those could include like volleyball or softball. And then also our individual and dual sports, your tennis, table tennis, badminton. So we're going to try to push more of those. We've also added esports, and we did some of that programming this summer. We'll continue those programs like that as we go forward. And then we're also adding and looking at adaptations, modifications to some of the sports, the flag footballs that do have those player-to-player contacts that could be eliminated. However, we would utilize some different spins off of those so we can still get some offerings there with those sports, including basketball and flag football.
Thank you, Dan and Dr. Flores. One of the things that I know that you're doing in the gym, particularly Dan, is you'll be using a mister to help disinfect the area when no one is in there, get it ready for the next day. Can you talk a little bit about how that works? And
Sure, we're working with risk management here on campus. We've got several measures that we've put in place to sanitize the CHP. We did open up the Ben Kelly Center for Human Performance building on Monday, this past Monday, July 6th. We have modified hours, and this time we're using as preparation towards the fall semester. All students, faculty, and staff are welcome to start utilizing it. Again, we are following those CDC guidelines on occupancy numbers. But as far as the mister, we mist the whole facility. It is a spray mist that sanitizes all the equipment, electronics, everything. We give it a spray every morning, and then we have heightened all of our staffing to include more on the floor and some measures that we've taken as far as cleaning equipment. My staff has come up with some great ideas on how to keep the equipment cleaned, using their resources across the state, and then local facilities as well. We've compiled all of those things to keep our ASU community as safe as possible.
thank you, Dan.
Mm-hmm.
We're going to move into more health and safety questions now. Dr. Flores, I'll direct this question toward you. If a student tests positive for COVID-19 during the semester, what is the protocol following that? And do they get to return home, or would they stay on campus in a clinic, and how do they get care?
Great question, Becky. And let me first kind of take us back a little bit that we're trying to take as many preventive measures as we can. So in addition to being required to wear a facial covering, all employees and students are required to screen daily if you're coming to campus. So if you're an online student and you're not coming to campus, what I'm about to say does not apply to you. Otherwise, everyone, I mean, including myself, I've been doing it for several weeks now. I screen every morning, and if there are any symptoms, I am directed to contact the doctor on demand provided by Shannon Hospital. And that doctor will give me directives if I need to go and get tested. And the reason I bring that up is going into isolation when you test is going to be required of students that are in the residence halls. So if you test for COVID-19, you will go to one of the apartments at Vanderventer Apartment, and you will remain there until you either test negative, or if you test positive, until you're released by the doctor that you are no longer able to spread COVID-19 to others. We will take care of you. We will check on you several times a day, 5, 6 times a day. We will check on your emotional state. We'll provide you with food and anything else that you may need. But we're going to need for you to isolate. And then if you test positive, you go from isolation to quarantine, which means that you absolutely remain in that room, but we monitor you even more to determine if there's some additional medical attention that we need to provide you, and so forth. So that's the plan. If a student is testing, then they go into isolation and quarantine. And the city of San Angelo is actually working with hotels as well to provide some space for isolation and quarantine. And so if we run out of our space in the residence halls in Vanderventer Apartment, then we will partner with the city to utilize some of the facilities that they have identified here in San Angelo.
All right, thank you. I think a lot of people have assumed or talked about whether or not students, staff, and employees coming back to campus will be required to test for COVID-19. And I think you pretty much answered that. It'll be a screening process every day. Is that correct?
Yes, ma'am, that is correct.
Okay. All right. Jessica, this next question's for you. Will ASU remain open to people who like to walk around on campus for exercise? And how will students know that they're safe if visitors are coming to campus?
Thank you, Becky. And first, I would like to echo the sentiments of the rest of the panelists and say thank you for those who are watching or who watch the recording after this is completed. We are very excited to see all of the happy faces coming back to campus. That's something I say every year. This year, I think maybe I should say we're excited to see all of the happy eyes peeking out over our facial coverings as everybody returns to campus. But as my fellow panelists have said, the health and safety of the students and our campus community are paramount. And that is forefront of everything that we are planning and doing. And that includes guests on campus, whether they're indoors or outdoors. So we've established these policies and protocols for the protection of the campus community and to help us to protect one another as we move through these unusual times, becoming more common now as the days go on. But the protocols that I'm talking about include wearing the facial coverings. That is a policy that's in effect whether someone is inside or outside of the building. So any of the guests who are walking on campus, or guests and visitors, vendors who are making deliveries on campus, the entire gambit, anybody who is on the campus grounds, in any of our facilities, on any of our facilities and grounds outdoors, are required to wear facial coverings, to abide by social distancing recommendations and guidelines, and for entry into any of our common or public buildings, we are requiring the screening process. And that applies to guests as well. We're still developing exactly how that's going to look for our guests to try to make it as seamless as we can. But more important than convenience right now is health and safety. And Becky, you alluded to the signage earlier, but we are also in the process of developing some yard signs and exterior signs that we can place out along the grounds and some of the common areas that our community guests visit often, to help educate them as well, because we know that they want to be a part of helping to keep ASU safe and healthy as well. So we want to provide them the opportunities to do that. But the short answer is that anybody who comes on campus, whether they're exercising outside or visiting one of our buildings, is subject to all of the health and safety protocols that we put into place. And that is to help us take care of each other and make this a positive experience for people return to campus.
Absolutely. Thank you. Uh, Dan, I'll direct this question toward you. How will face coverings be beneficial in the gym for those people who have asthma or other conditions that they can't really breathe well in a face covering?
Well, the face coverings, again, right now we're mandatory on campus for face coverings. Anyone that has a condition or needs accommodations for that, it's not recommended that they wear a face covering. We do have options for them to seek out accommodations through Student Disability Services. Dallas Swafford, as Dr. Flores mentioned earlier, she is going to work with any student that needs or seeks accommodations. And we, just like any other accommodation across campus, if they're coming into the rec center to work out, we're going to work with that student, whatever measure needs to take place on that. So we're going to enforce the face coverings, but those accommodations do need to be sought out through Student Disability Services, and we will support any decisions through that office.
All right, thank you. Dr. Flores, one of the questions has been, will students still be able to congregate in common areas if they wear face coverings?
Only if they are going to be discussing that literature novel that Dr. Wagner spoke about. All kidding aside, absolutely. And I don't remember which panel member spoke earlier that the goal is really to have both. But when you can't have the 6 feet of social distancing, then the facial covering is really important. And in the state of Texas, it's mandatory and required right now. So as long as you have your facial covering, you can congregate. And again, we want students to be able to have study groups. We want students to be able to engage in scholarly discussions and really just how to work with other students and learn from each other. Both information that you learned in the classroom, but also just cultural differences and everything else that we know occurs on a university campus. So yes, we encourage that. Inside a residence hall, we are not saying it's required because that's your room. But let me say, if you have guests over, just as if I have guests coming over to my house, I am going to wear a facial covering because I want to protect you from any germs that I may have. And so that's really the same rule. And Dr. Wagner said it best. What we learned when we were in elementary school, that's really what we want to apply.
All right. Along those lines, will there be restrictions for ASU organizations or any changes that ASU organizations have to follow?
Yes, they will. And Jessica spoke about capacity, and I think Dan did too, and maybe even Dr. Wagner. So we're being mandated to reconfigure the capacity size of our rooms, and that includes meeting rooms. So we're going to have the Rammies in August. We're going to limit that to a number under 100. One, because we're following the state law, and then the other is the capacity. So student organizations will have to work very closely with registered student organizations, Emily Bonda, the coordinator, to make sure that they're in compliance.
All right, thank you. Another question is, what are plans if COVID-19 runs rampant in our dorms, in our residence halls?
So that goes back to our plan of we have identified plans for isolation and quarantine. But more than anything, it will be so important that students and really every member of the ASU community, employees included, are doing their screening and are honest about the screening. You will be given a badge that you can have on your cell phone. And for example, to walk into the University Center today or tomorrow when they're open, or the rec center, which is still up until 8 p.m., you have to show your badge, and it has a green square with today's date and your picture, Dr. Wagner, from the very first time that you had your student ID picture taken here on campus. But so we're trying to be proactive, but at the same time, we know we will have a case. And so isolating that situation from the minute that the individual tests. And then we're also training individuals here at ASU to be contact tracers, which really has been a county health task. Well, the county health officials are overwhelmed here in San Angelo, so we can assist, and in the Concho Valley, we can assist by having trained professionals to start anytime a person tests positive to say, all right, who have you been in contact with? Your ID card will have some information, and we'll have contact tracers that know you well. Perhaps it's a faculty member that advises one of your student organizations, or someone that advises a student organization, or Dr. Petty's office in the student affairs office.
All right. Thank you. I'm going to switch over to Jessica for some questions here for a minute. And for those of you who don't know, Jessica has a number of responsibilities. She has a very big job, but part of her role is to oversee the vendors on campus, the retail vendors, and our auxiliary services, such as dining. So I'm going to ask you, Jessica, can you tell us how those retailers and auxiliary services plan to operate safely this fall?
Yes, absolutely. Thank you for asking. We've been planning for this like everyone else pretty much since we went home for after spring break. And we had the opportunity over the summer because we did still have students living on campus. And as long as we have students living on campus, we're going to have food service on campus to take care of those students. And so over the summer, we were able to pull back and follow the model that the restaurants were following with carry out food only. However, as we start gearing up for the fall and the expectation of more students joining us back on campus, we are working to activate more concepts, more food service options again for the fall. But the most important thing that we're doing is rerouting some of the traffic to those retail operations so that we reduce the density, the capacity in certain spaces. All of our retail operations, so when you talk about our food service operation, our campus bookstore, Ram Central Station, our campus banking center, which is operated by Concho Educators Federal Credit Union, all of those partners are going to be following the same protocols that I mentioned earlier with regard to social distancing, facial coverings, and screening upon entry to the campus facilities. But we're all also adding additional enhanced sanitization processes. We're doing some of that in partnership with our campus custodial partner, ABM, but in each of our areas, we're also designating what the people I've been calling the super sanitizers on our staff who are helping to sanitize those high contact touch points. The elevator buttons, snack and drink vending machines are part of our purview, and it's important to us that we have plans to sanitize those so students and guests feel comfortable using them. With regard to the bookstore in particular, we're doing something that I think is fantastic this year. As we get ready for fall rush, the bookstore is always a hotbed of activity. People picking up book orders, running by to get shirts and memorabilia and things to send to their family to show that, hey, I made it to campus. And we want people to be able to do all of the things that they would normally do. We're just looking to do it a little bit differently so we can be smart and safe about it. So for the fall rush, or move-in week, if you will, for
the bookstore operations, we're going to decentralize some of what we're doing. So if you've placed an online order for your books, you don't have to come pick them up at the bookstore here in the University Center the move-in week of school. Instead, we're going to have a satellite station. Dr. Matz at the Porter Henderson Library has been kind enough to partner with us and offer us the east side porch of the library, and we're going to use that as a distribution center for online book orders. And that diverts a large amount of that traffic so that those who do have business to handle physically in the store are able to do so, and we're staying within the confines of the reduced capacities that we've had to operate with. Food service, we're doing the very same thing. We have a fantastic online ordering mobile app, and we're really going to be promoting and marketing that to the students and educating the campus community about ordering their food in advance and showing up just in time to pick it up, and then they can go dine elsewhere in their residence halls and their offices, somewhere out on the campus grounds if they'd like. We're doing a lot of those things, and we're going to have the food service. The online ordering pickup is also going to be separate and away from the walk-up food service areas. So we're really focused on reducing the density, the crowds, and managing the traffic flows so we can provide all of the services that we normally do, just a little bit differently with everybody's health and safety in mind.
All right, a lot of planning and that whole process there.
A lot of
That's
time.
good. Well, and we have a question. Apparently somebody's already thinking about the end of the semester and wanting to know if book returns will only be taken through the book drop.
Well, and I think that might be a library question because the bookstore doesn't have a book drop.
Okay.
So I would defer that, but I will say at the end of the semester for bookstore returns, we will be doing the same thing that we're doing for the start of the semester. We're going to set up some satellite units. So it's actually a great question, Becky. We're going to set up satellite units. We would like students to be able to return their books at a variety of locations on campus. We have a fantastic spirit trailer that we use for spirit rah-rah merchandise that we sell at football games and other sporting events. And it's a very handy tool to move around campus to operate as a remote location for that. So we'll release those plans closer to the end of the semester, but we are already talking about decentralizing our operations and setting up some remote locations for good traffic flow throughout the semester.
All right, great. Would you also talk while we're hammering you with questions here for a minute? Would you also talk about Angelo State's student health clinic and our counseling services?
Oh, you bet. I appreciate that question as well. The health and wellness of our students and our campus community, as we've said over and again, are our top priority. But I'm very proud to say that throughout all of the shifts in operations and even remote operations, we haven't missed a beat in our student health services or our counseling services. They've actually been on throughout, and they will continue to be on and ready for any students who come to campus, or even our distance education students or online only students. So to tell you a little bit about that, any student who's a medical services fee payer has access to the student services at the Shannon Clinic or the counseling services, the counseling center. If you're an online only student and you want to get access to those things, it's easy. You can contact our bursar's office on campus, pay into the medical services fee, and you're activated with all of the same services. We have a lot of online students who are local and take advantage of that opportunity. If anybody should ever have any questions about it, I know my name is presented here, but feel free to call me and email me anytime. We partner with Shannon Clinic, who is a premium local healthcare. They're really our leading local healthcare agency, and they operate our student health services. And we have a fantastic new state-of-the-art clinic that has been built here on the campus grounds, and it's called the Shannon Clinic, Jackson Street location, also called the Student Clinic. It's actually adjacent to the Janelle Center Stevens Arena, where our athletic departments are housed. And so it's a great facility, but in addition to the access to that facility, any student who pays the medical services fee has access to go to any of the Shannon Clinic urgent care locations. So that's 4 other clinic locations available around town. Well, our campus clinic location is Monday through Friday, 8 to 5. There are other other Shannon Clinic urgent cares that have operational hours Monday through Friday from 7 to 7 and on a weekend from 7 a.m. to 10 p.m. So we try to make healthcare as accessible as possible to our students. With regard to counseling services, they're located right here on campus, and we have a great partnership with our counseling services and our director of counseling services. And he even told me today, we're ready. Any student who needs our help, we're here to help them. They've been providing services, as I said, seamlessly, and they can provide services in person, virtually, or some hybrid of the two, depending on what is best for the student who needs help or needs time to counsel or visit. So they are gearing up and ready to go for the rest of the students to return to campus as well. So much of what we've been doing has continued, but I appreciate the opportunity to talk about it because those are important things that we want students to know. As soon as they hit the ground on campus, it's just a couple of minutes in either direction for the help that they need, and we're here to help them.
Sure. Thank you for that information, Jessica. I think one of the things that has been so beneficial for Angelo State as we've gone through this whole experience is our partnership with Shannon Health. And we're also very lucky to be part of the Texas Tech University system and have access to the knowledge base with the health science centers that are also part of the Texas Tech system. They've contributed a lot to our plans and our discussions, and I think that has made us very lucky. And Shannon's a very active partner in our planning and process. So I'm going to ask one last question from the pre-submitted questions, and then we will get into some of the questions that have come in while we've been talking. Jessica, this is another question for you as you take a drink. Let me time it just perfectly. A question about the pool tables, vending machines. Will those things still be around campus and available?
Sure. So the vending machines will still be around campus and available. And in fact, we're really working to maximize their value in that we're working with our vending partner to add to the product mix some personal wellness items like hand sanitizers, facial coverings. So if somebody finds themselves somewhere on campus and they don't have what they need, we'd like it to be convenient and accessible to them. So the vending machines will still be available. As I mentioned, we're working with our contracted partner also to increase the sanitization processes around those to make sure we have hand sanitizer installed around all of the vending units so that people feel comfortable as they're using the vending machine and they want to sanitize as they walk away. We'd love to have them do that. We're also looking at some other models of vending machines, but those take a little bit more time to make a transition like that. So really, as we gear up for the fall, we're focused on sanitizing and safe practices around the machines we do have. Now, with regard to the pool tables that we have here in the Houston Hart University Center, we have taken those offline for the time being. And some of that is because pool can be such a passionate game. It's very difficult for people to socially distance themselves when it gets into the heat of it and they get excited. That's not to say that we can't reconsider other ways to provide entertainment options in the Houston Hart University Center as we move into the fall semester. But for the time being, we felt that the safe decision was to take the pool tables offline.
Okay. Thank you. This has all been very informative, and I hope that our audience sees there's kind of a theme here of flexibility. We are willing to work with students, faculty, staff, and if a student is ill during the semester, I think professors are very willing to work with them and help them finish the semester, even though they can't necessarily be in class and participate. So we'll go into some of the questions that we have received online. We've actually gotten quite a few. So let me scroll through some. I think one of the questions is, will housing be different, Dr. Flores, and what will it look like? I think, there's a question about, will students have their very own rooms? Will they still have roommates? How is that going to work?
So, one of the great things about Angelo State University, and there are many great things, is that our residence halls, none of our residence halls have community bathrooms like so many of the other universities. And what I mean by community bathroom is you go down a hallway to shower or to use the restroom. All of our rooms have a bathroom that will serve 2 students at most. And the other thing is, we don't quadruple or triple any of our rooms. All of our rooms were already double occupancy. So you hear many of the universities saying, well, we're going to reduce the level of occupancy in our rooms, where they're going from 4 students to a room to 3, or from 4 to 2. Well, so 60% of our rooms are single rooms, and the remaining 40% would have a roommate there as well. And many of the roommates are individuals that are already being assigned, so students can get to know each other and already begin to discuss some of the safety habits that they may expect of each other, and things like that. So it's not going to look completely different from that standpoint, other than, again, when you're in the room, and we have said X number of students in the room to reduce noise and things like that, we may start reducing some of that a little bit more. And when you're in public spaces, in the hallways and things like that, the facial coverings will be required. We may put a capacity of how many people can be in the laundry room, because again, social distancing while you're doing the laundry. And we have some study spaces in the residence halls. But in terms of living accommodations, um, that's really not going to change much because of the design that we already had in our residence halls.
Okay. We also had a question about the common areas in the residence halls. I think this is kind of like the pool tables and other areas where students tend to congregate. Will face coverings be required in the common areas of the residence halls?
Yes, they will. So
Okay.
many of our residence halls have very comfortable sofas and in front of a TV and things like that. And we want you to still be able to enjoy those amenities, but you'll have to have a facial covering anytime you step out of your personal space, i.e. your residence hall room.
Okay. Thank you. Dan, this question is for you. I think as you were talking about the way the rec center is going to be disinfected, a question came up about the pool, how the swimming pool is going to be disinfected, and then how we're requiring mask everywhere else. Will masks be required? How will that work with swimming?
Okay. The mask will not be required in the water. If you wear a water approved mask, absolutely, but your face coverings is not required. CDC specifically states on that is acceptable to be in the water without a mask. The chemicals used for the pool will be the sanitizing for that area. This is there's research done on this that shows that you're not going to have a spread through the water. So we're still going to use the sanitizing methods that we're using all throughout the building for the other space in the pool area, benches, things like that. We will minimize, or with our reduced occupancy, the numbers will be smaller than they have in the past. And so that way we can kind of control the areas that we're cleaning, those touch points throughout the day. We are open. The pool is currently open. We're doing those things right now. Currently with the CHP, the weight room locker room and the pool are open, and the cleaning methods are the same throughout, with some modifications depending on the activity area.
All right, thank you. One of the questions that also came in is, do the daily wellness screenings apply to students who live off campus? And I believe I heard Jessica talk about anybody who comes to campus is required to go through the screening process. So if you're a student living off campus but taking classes on campus, you do need to do the wellness check that Dr. Flores talked about and get your electronic badge on your phone. But if you're an online student only and you don't have any reason to come to campus, you don't have to do that screening. Jessica, you might be able to help with this question. We had a question about what does the screening actually look like, and what are
Sure.
the questions and how does that work?
Sure. Actually, our screening was, the screening questions were developed in conjunction with our medical services partner. So we've had the benefit, as you mentioned earlier, Becky, of partnering with Shannon Clinic, and we've even received advisement by their lead epidemiologist in this regard. We also are following very closely, as everybody has said before, the CDC guidelines. And so we model our screening questions after CDC guidelines with input from local health professionals as well. And it's really a very seamless process. I would recommend for students who live off campus and may only come to campus once in a while, I would say it's worth the 90 seconds it may take you to go in and try it for the first time. And the first time you try it, you're gonna love it. It only takes, it's a series of, I'm thinking 1, 2, then checking off maybe.
I have it open.
Oh, thank you.
If you like, Jessica, that's what I was doing. So the first question, in the past 72 hours, have you had fever of at least 100 degrees Fahrenheit or chills? Yes or no? And if you say yes, you can guarantee that you're going to be told you need to call the doctor on demand. In the past 24 hours, have you had any of the following symptoms? Fatigue, cough, shortness of breath, or difficulty breathing, whole body muscle aches, new or worsening headache, new loss of taste or smell, a sore throat, congestion or runny nose, nausea or vomiting or diarrhea. And if you list any one of those, then you'll be asked to call the doctor on demand. And this really becomes an important point, Becky, in that many of us, and myself included, have self-diagnosed ourselves for years. Oh, that's a chronic allergy. You know, whatever allergy that the news said last night was high, that's what I have. And so that's why I'm coughing or whatever. This is not the time to self-diagnose, especially when you can call the Shannon Doctor on Demand at no cost and let a MD, a medical doctor, guide you with the next step. And then the last question is, or not the last one, there's a few more. Have you been in known close contact with a person who is lab confirmed to have COVID-19? Yes or no? Are you being quarantined or living with anyone who has tested positive and in isolation for COVID-19? And then we say, have you reviewed the RAM family protection standards? And there's a link to it, and agreed to abide by them, and that you certify that the information you provided is true and correct. Foundational to the RAM fam culture is integrity and honesty, and that leads to safety.
Very good. Thank
And here's
you.
just to show, so when you get your badge,
That's what it looks like right there.
the beauty and convenience of the badge, as for guests, students who live off campus and they're coming on campus, you present your badge as you're entering our facilities. and you're good because we know you've been pre-screened, you've done the pre-screening. For those guests or students who aren't using the wellness tool that we have via Ramport, they will be stopped on the way into our public and open buildings and locations, our auxiliary locations. And we have a screening process, just a manual process set up where we have attendants there at the table to ask the same questions, take your temperature before allowing you to enter into the facility, much like you find if you're going to a number of other locations around San Angelo. So I really, and we're trying to educate guests and students, faculty, staff, excuse me, as they come in to our space, even this week in the Houston Hart University Center. Those who don't know about the app yet, we're really or the wellness screening tool, we're really promoting that because it's just so convenient to have. And usually once they come through the person-to-person screening one time, and then we tell them about this, they love it. And you get to show off the picture a little bit too, so.
Absolutely, except maybe Dr. Wegner. He might not want to show his mother his badge. I want to just go back through this real quickly because someone was asking. So the process is logging into Ramport, and students will go, to the student tab on Ramport, and you'll see the wellness check right there, and then you'll answer those questions, click submit, and if everything's clear, I don't know this part because this is technology magic, but it does appear on your phone no matter where you take the screening. So it is magic. But we will have people checking at doorways, and in fact, at the UC, I think we're going to be limiting to one entrance. So we will have people there checking. So we are a little bit over time, and I have one more question that I want to ask of Dr. Wegner. I think this is important for the group. How will the semester work for students who have field work or observation?
Yeah, first of all, I'm sort of stuck on my picture because the one that pops up for me is literally the one I took in 1997. And so, some people get better looking with age. I'm still waiting. That's the goal. We're those departments. I'll preface this by saying we're going to do everything we can to maintain those fieldwork activities in the same way that we always have. But I also want to hesitate a little bit about offering a sort of broad answer because some of those fieldwork issues and those off-campus activities are really discipline specific. And so what I would say is for students like that, what we generally recommend is to contact the department chair and let that department chair walk you through the plans that they're making. Because I got to tell you, in addition to all the other planning, and I listened to Jessica a minute ago, and I was exhausted just after listening to all that they're doing. Academic departments are doing the same kind of stuff. And so, they've got, it's actually relatively easy to talk about what you're going to do in the classroom. It is all those kinds of things like that. What do we do with internships, student teaching, field work, research trips, those things? And they're all making their plans dependent upon CDC guidelines, health and safety, what they can do for their students. And so I really think the best, I'm not trying to avoid answering it, but I also don't want to get the wrong answer. So I'd reach out to department chairs and let them walk you through what they're doing and how they're setting up their safety guidelines. And again, it's easier in some areas than it is in other. I mean, if you're going out to the ranch, it's pretty easy to social distance at the ranch. I mean, there's a lot of acres there. You get that 1,000, you get that 1,000, and they're traveling in advance a little bit different. So let's just reach out to those chairs and let them answer that question.
All right, thank you so much. So that is it for answering questions this evening. I think that I heard a theme of flexibility here this evening. I think as far as students who have questions, please ask your professors, talk to your advisors. I know anyone on this town hall this evening would be happy to help answer questions. That is one thing about the Ram family. We say that a lot and we really mean it. We do take care of our own, and don't be afraid to reach out to someone and ask your questions, and don't be worried about if you get sick, what's going to happen, because you can talk to your professors, email them. Everybody I think is willing to help. again, safety is our number one priority. So we've talked about a lot of measures we're taking tonight, but we're realizing that that could change depending on what the situation is. So I want to thank our panelists very much for participating tonight. We've kind of run them through the mill with questions. I want to thank everybody who was able to attend. We had a good audience tonight and lots of questions. And so we wish you safety and wellness, and we hope you'll join us for our next town hall next week as Dr. Flores gets masked up and ready to leave. Our next town hall will be next week, and we will talk about student life and student activities on campus. All right. Good night, everybody, and thanks for joining us.
Good night. Go Ram and Ram Bells.